Colleagues, may I request that you move to a seat? So it is my great pleasure to welcome onto stage Dr. Rima Salha, the chairperson of the Early Childhood Peace Consortium. Dr. Rima has a very extensive bio that I won't be reading out. It's in your Dropbox. But I would like to just briefly mention she is a one-person crusader who has spent her entire life fighting for change, social justice, and giving voice to the rights of children. For those of us who have had the great fortune to work with her, we are continually inspired by her every day, because there isn't a meeting or a chance to be with her when you do not realize her immense humility, but enormous drive and belief that we will make a difference. So please join me in welcoming Dr. Rima Salha.
Your Royal Highness, Princess Sarah Zeid, Excellencies, distinguished participants, friends and colleagues, Assalamu alaikum, and welcome again to my country, Jordan. It's my great pleasure now to introduce Her Royal Highness, Princess Sarah Zeid, a great advocate for the health of women and children, and from the movement, Every Woman, Every Child. Please. Welcome. His Excellency Zeid El Sayegh, former Minister of Social Affairs in Lebanon, and also a great advocate for women and children. Please. Dr. Rabia Shamai, the head of Mental Health, Ministry of Public Health, Lebanon, and a pioneer in mental health in Lebanon. Please. Dr. Frederic Affolter, manager and peace building education and advocacy program, also a pioneer in UNICEF in peace building and education. It gives me great pleasure to introduce the panel on policy perspectives, policies that invest in women and young children as peace builders. As we've heard this morning, today millions of women and children around the world are living in situations of armed conflict, occupation, violence, and insecurity. This is a time of unprecedented displacement of more than 60 million people, mainly women and children, and more than 125 million people are in need of humanitarian assistance, according to the new humanitarian report launched in February by Mr. Ban Ki-moon, the Secretary General of the United Nations. Images of children from Syria, Central African Republic, and Gaza continue to haunt us. These challenges are testing the resilience of communities, national institutions, and stretching the ability of the international community to respond. It is true that women and young children are particularly vulnerable during times of conflict, and their rights are violated every day. But women and children are not only on the front lines as victims, but as powerful agents of change and peace. A growing body of evidence shows that participation of women in all aspects of peacemaking, peacekeeping and peace building has a tangible impact on human security and on peace and security in general. Women also play an important role in sustaining peace by anchoring the peace dividends in their communities. This is accomplished by investing their huge potential in countering violence, by promoting social cohesion, by resilience and reconciliation. As we've heard this morning, also emerging and well-established scientific evidence, decades of landmark research and recent scientific evidence from multiple disciplines continue to substantiate the link between early years and early life environment with long-term well-being, violence prevention, and behaviors linked with peaceful communities. The formative years of life, as mentioned yesterday by my colleague Pia, and intra and inter-family and community relationships are powerful agents of change that can promote resilience, social cohesion, and peace. Early childhood development has a transformative power to create legacy and sustain peace. But the peace-building discourse, as we know, and practice have traditionally failed to be inclusive and acknowledge the participation of every member of society, including women, youth, and children, in building sustainable peace. To change this tide, it has become vital to set a powerful tone, to shape innovative and transformative approaches to peace building. Yes, we have every opportunity to make this transformative shift and elevate the role of women and children on the peace and security agenda and on the peace building agenda. The 2030 Agenda for Sustainable Development offers an opportunity to make this transformative shift. Within the agenda, a cluster of goals: 4 for education, 5 for equality for women, 16 building peaceful societies, and 17 for partnership, provide an opportunity for increasing the investment in young children, women, and their families for peaceful societies, as well as engaging them in the process. The adoption of the Security Council Resolution 1325 and the subsequent resolutions dedicated to the Women, Peace and Security Agenda have also provided an impressive normative legal framework integrating women's equal participation in peace and reconciliation. Yes, women's empowerment is a critical force for sustainable peace. The newly adopted Security Council Resolution 225 on youth, peace, and security, which was presented and sponsored by Jordan, offers a unique opportunity as it focuses entirely on the role of young men and women in peace building and countering violence. All this is compounded by the rise of civil society. I had the chance to visit 12 or 13 countries all over the world last year, as I was member of the high-level peace operations of the United Nations. And there we met women and children. We met communities that raised their voice and said that they want to be involved in peaceful societies. They want to promote resilience, social cohesion, and peace. The question now is, how can we translate knowledge? How can we translate the efforts of the international community to prevent violence and sustain peace? How can we translate, most importantly, the voices of people into policies and programs to empower women and children so that they claim their roles as peace builders? Today, we have with us on this panel eminent personalities, as you see, and distinguished speakers who will share their experience with us and tell us how we can move together to achieve our goals. Thank you. So as you see is an armchair discussion. Yeah. Thank you. Princess, Your Royal Highness, Princess Sarah, the global movement, Every Woman, Every Child, that aims to save the lives of millions of women and children and is dedicated to provide health services to them. Have you observed that through the provision of these services, cohesion can be strengthened in the family and in the community, particularly in very fragile environments?
That's what I'm going to do. May I please beg your indulgence? I'm going to go rogue. I am I'm going to stand up to speak. I apologize. And I'm not actually going to answer that question. Very badly behaved. The reason that I'm not going to answer that question, again, no disrespect intended, is because I started thinking about all of this last night, and so I have been scribbling, and at some stage as I go through this, my head starts turning. It's just because I'm trying to get a handle on my own handwriting. As a mother, the links between early childhood development and peace and security are, to use the very technical term, a no-brainer. Mental and physical stimulation, touch, love, kindness, and endlessly repeated messages about sharing, respect, that actions and inactions have consequences, responsibility, and did you wash your hands? Are the bedrock for children and guide the hands of their moral compasses. It is so obvious, and yet we live in a world of enormous and urgent need, tight budgets, and short attention spans that require quick results. So how are we going to reach the objectives of instilling early childhood development and caring for the youngest of our people? Some of my practical recommendations are that we prioritize the sexual and reproductive health rights of women and girls, meet their needs, uphold their dignity, and unleash their full power and potential to act as first responders, partners, and agents of change. A woman's right and ability to access quality sexual reproductive health services remains contested and the least supported essential services at the time of crisis, left out, neglected, or rejected. And yet, in order for her to participate and contribute, she and her children must first be healthy. For a girl to remain in school, she must have access to hygiene products. For newborns to be healthy, their mothers themselves cannot be children, and in all circumstances, they must have adequate levels of nutrition and support to conceive when they choose, carry, deliver, and nurse. In Zatari on Tuesday, I was privileged to meet 2 women recently delivered of beautiful, big, healthy babies. One of the mothers was 16 years old, and this was her second child. The other mother had just brought into the world her 8th baby in the space of 10 years. We must count everyone everywhere. In a number of countries, newborns are not given birth certificates or identity cards if the mothers cannot provide a marriage license or name the father. Does this mean that we're not counting the children conceived in violence and rape? Or that the children whose mothers have had to run and do so without papers? Are we denying them access? Could you hear me? Yes? Thank you. We deny them access to services because they do not exist. We do not count maternal deaths of girls under the age of 15. What critical interventions are we missing? What advocacy tools are we not armed with to end this horror? In Nicaragua, 30% of mothers are under the age of 15. And lastly, the emotional and mental well-being of mothers. We have heard yesterday that children are resilient, that they can still imagine peace after horrors. A mother in mourning for her husband, her child, her pregnancy, or her personal dignity, or who has PTSD, is most likely unable to advocate, love, or care for her children. If she can be found and supportive, it could have a profound and lasting impact on her children, on her family, and on her community. And our role in this, as I see it, We have to transform the existing financial mechanisms. In 2014, of known humanitarian funding, only 0.2% made it directly to the community level and local NGOs. And humanitarian funding is given year by year. Predictable long-term funding is key. Long-term planning is key. We cannot do this unless we change our financial mechanisms, especially in the hardest of places, where the needs are the greatest and where support could be transformative. Community organizers, women's groups, and religious leaders reach people, men and women, girls and boys. They support and they can ultimately heal. Thank you.
Thank you very much. And now, Your Excellency, Minister Zeid and El Sayegh, women, children, and their families are bearers of rights. Often they are victims in situations of war and conflict, but they are more than that. They also can be and want to be agents of change and peace. How can we mobilize governments, policymakers, academia, and civil society to take action and support their agency?
Thank you. Well, good morning. I'll try to follow the example of Her Royal Highness and not answer the question. Well, I would like to praise the conceptual framework put by the Yale University and Mother Child Education Foundation, the ecology of peace. It really has served for me as really a platform for research and policy shaping and making. In my capacity of scholar and policy maker, I would like to present my ideas according to 2 points by showing the main obstacle to policy making from my experience in Lebanon and to see how we can overcome those obstacles. First of all, the obstacles. I can imagine them in 2 categories, the structural obstacles and the contextual obstacles. I might be going very fast, just on titles. I will leave it up to the Q&A later on to develop if any need for that. The structure. The problem we are facing is that we are thinking that there is a state functioning. And the problem is that we think that there is a policy making or policy shaping somewhere. What happens when we have a failed state or a failing state or a weak state? And still we have obligation towards childhood and towards women. This is the case of my country, Lebanon. This is the case of many countries in the Middle East. We still have obligations, but we do not have responsible states capable to fulfill those obligations. Second, the obstacle I foresee is how to make diversity a source of welfare rather than a vehicle of conflict. And yesterday, Dr. Muhammad spoke about this important issue. Diversity is cultural, is religious, is ethnic, etc. And of course, the answer is beyond the early childhood policy per se. Third, how to build peacemakers with the children and women in situation of mixed nature. It means when we have coexistent conflict and stability at the same time. Usually we reason in a linear form, saying that, well, the conflict has ended and now we have to go towards peace. Peace making, peace building, etc. What happens when we have together coexisting Hong Kong and Hanoi, okay? And therefore, this is the situation in the Middle East, in Iraq, in Syria, in Lebanon, in Yemen, etc. What is this real space for critical thinking when we have half of the population mobilized in war? war against extremism. It could be against terrorism, against the other who could be inside me or inside my head, okay? And at the same time trying to have peace builders. This question is particularly addressed to the Palestinians. I was a senior consultant, I'm still consulting for UNESCO on intercultural dialogue in the Middle East, and we have sent a questionnaire to Palestinians saying that we're talking about intercultural dialogue. And to my amazement, we had no answer. Nobody accepted to fill the questionnaire because they do not want to hear about dialogue that could lead to peace. At times, the society is mobilized to win independence or to fight with the enemy, and that situation could be. We have another example in Sharm el-Sheikh in Egypt last year when we were giving a training for scholars who are to implement a syllabus we developed with UNESCO on intercultural dialogue. And we've put some qualifications on some terms that could be sensitive in terms of dialogue. And to my amazement, I have seen a dean of a school who has published on dialogue against a scholar, another scholar, because she did put the term questioning that considered as sensitive that related to the Muslim Brothers. And we were among scholars, and I have to be a peacekeeper then.